All righty. It looks like folks are making their way down the technology hallway between the conference platform and Zoom. It's great to see. It looks like everyone's audio is connected, so we're able to be together successfully. This is phenomenal. Thank you so much for joining us for the Q&A for this really, tremendous session, one of great interest and excitement, the Family Navigator Program, Successful Connections Beyond Barriers. My name is Andrea Cornell from AMCHP. I'm going to be asking our presenters the questions, the many wonderful questions that you all have submitted in the platform. We also do have a fair amount of time for a lot of interaction and space outside of just those questions. So I really do encourage you, if you'd like to dig deeper into one of the responses, we want this to be more of a conversation as well. And we will do our best to get through all the great questions that have been submitted. If you did not get a chance to submit your question in the platform, let's now turn our attention wholly into Zoom here. So please just submit it in the chat box in Zoom. You can also ask us to go deeper into a question or an answer in that space as well, so that this can be a fun, interactive space with a really tremendous group. So with that, I will turn it over to our speakers and ask you to introduce yourselves before we get started.
Hello, everyone. Good afternoon. I'm Dr. Maite Schenker. I'm a clinical psychologist and faculty at the University of Miami in Mellman Center for Child Development, and I'm faculty lead in the Family Navigator Program.
Hi, good afternoon, everybody. Thank you for being here and showing your interest in our beautiful and efficient model. I'm Nancy Torres. I'm the director of the Family Navigator Program. My professional background is in the psychology field. And also the proud mom of a teenager with a disability. And also I'm a LAM faculty at the University of Miami.
Hi, everyone. Thank you for being here. My name is Gabby. I am a third-year medical student at the University of Miami. I'm in the MD MPH program, so I will also be graduating in 4 years with my master's in public health in addition to my MD degree. And I research with the Family Navigator Program, and I've been working with them since my first year of medical school. And I am an older sister to a sibling with Down syndrome.
Phenomenal. Thank you so much for being with us and holding this space and answering many of the questions that have been submitted. So without more delay, as you know, there were a lot of questions wanting to hear more about the navigators for your program. So sort of the top two questions that we're hearing a lot is, one, how do you get navigators for your program? Do they have to have lived experience? And to add on to that, a complementary question is, do any of your patient or family navigators identify as having a child or youth with identify as having a child or are youth with individuals who have a disability or special healthcare need? So that's our top question. I will pass the floor to you all.
Sure. Yes, and that's a really important question, something that from the beginning of the program, something that we wanted to be very much part of the Family Navigator experience was to have navigators who were parents or relatives of children with disabilities themselves and could provide the peer support component, as well as the education and the connection, which are the other two major components of our program. So yes, absolutely. Our family navigators are parents or family members of children with disabilities. And we get our family navigators in different ways. The University of Miami has, of course, its policy in terms of HR, and we have to advertise the positions whenever we have a vacant position. But in addition to that, we let a lot of our partners in the community know about our position, programs like CARDS that specializes in working with families with autism, among many other agencies and organizations in the community where we know a lot of parents are active participants. We kind of let the word out so that we can access those families as well. We also have a land program in our university, and we have families and parents that participate. In fact, one of our current family navigators was a land trainee, a passive family member, as a parent, who had a lot of the qualifications we were looking for when we were looking for a family navigator. So we ended up hiring her in that position.
Fantastic. Wonderful. Thank you so much. All right, another question that has come through, again, from the interactive online platform. An individual asks, it looks like you average around 500 navigation cases per year. How many navigators does it take to meet that annual need?
That was a great guess. That was a great guess. Definitely, we have a contract with our funders, the TAP Foundation, located in New York, where it says the number of families that we have to serve every month. That number is 30, but we serve almost the double. We are between an average number 45, sometimes even 60 families per month. So yeah, that's a very correct number. We are around 450 families and 500 families per year. We currently have 2 part-time family navigators. Okay, each one is 24 hours. 24 hours per week. And also, when it's needed, I can work as a backup family navigators. That happens when we have the overflow of families.
You're muted, Andrea.
Thank you. It's going to happen. It's bound to happen with all these Zoom meetings. I apologize. So another question that came in, just an interesting one, as they all are. How do you define a successful connection? What are the measures?
Yes, very important question. We have different outcomes, right, that define the success of our program. And one that is very important is the percentage of successful connection. And we understand a successful connection when in the follow-up process with the family, there is a moment when the family report that they already had an appointment, they are in the process to get a meeting, a conversation, or they are already enrolled in at least one of the resources that we provide to them. So successful connection is based on pattern report, and that's the moment we proceed to close the case. I think there was another question regarding for if we have some kind of follow-up process, and definitely we have it. After the intake process, we will do the follow-up process as long as the family needs. For some families, it can be 1 week, 2 weeks, because they are ready in that period of time. And for other families, it could be 4 months, 5 months. We usually call the families once a week. There are some situations when we know that the time they need to get an answer from the connection that we suggest, it will take more time, like, for example, APD, the Agency for People with Disabilities. So we will maybe call in 2 weeks to see how things are going. But that's what we understand as successful connection.
Perfect, wonderful. And thank you for also addressing the question about how often and how you follow up with families. Perfect, multiple questions at once. And then another question came in related to, do you get your referrals from providers or social workers? How do they know about you?
Wow. Well, they know about us because we have solid presence with and a communication and marketing process with our programs and clinics located at the University of Miami, and also with our external partners and agencies in the community. So we spend a lot of time participating in community coalitions, meetings, and knowing who is who and what is happening in this specific organization, and of course, explaining what our program does, and encouraging other community partners to work together, right? Because we can have referrals both ways. So that's an important part of the success of this program. You have to be out there. You cannot be only sitting in the building waiting for families to come. You have to work with your clinics, with your programs, and also even the clinics that have a long time working with you, sometimes they forget, they hire new staff that maybe they didn't hear about you. So we have to do some booster sessions with them once a year to remind them that we are here to support their family. So it is a constant process.
Booster sessions. That's such a cool way of framing it. Fantastic. Very fantastic. There's another question here. How do the navigators connect with families? Phone, virtual, in person?
the three of them. With some clinics located at the University of Miami, we are in person with them. So in the moment that the family is having a medical appointment, we can be talking to them at the end of the medical appointment, and we will do the follow-up process over the phone. Of course, when COVID came to our lives, most of the clinics moved to the virtual modality, and as we did too. And then we offer our families the option to do Zoom meetings. That is also, nowadays, we keep that options. So our families now, nowadays, we see some families in person for those clinics that have resumed their services. Other ones, most of them are over the phone, and some of them are over Zoom. So we always adapt to what the family needs. And there are times when families request an in-person meeting because they feel more comfortable to be talking to us right face to face. And definitely, if they are able to come to our office at the Melman Center, we will receive these families in person.
Perfect. Another question that came in during the presentation was, how do you address or how do you support families that have distrust of systems?
Yeah, and that's an important question, right? And it's actually a barrier that we have started to, as you saw in the presentation, that we started to collect that information about. Something that through the program has been in existence maybe for about 6 years now or so, and as we go, we learn and we adapt and we change, and we started collecting more information on barriers, I would say maybe 2-3 years ago. And in order to, when our family navigators identify a family member or an individual who is struggling with not trusting the system, with bad experiences, I would say the first thing is to be able to hear them out, to be able to validate their experience and their feelings, and be supportive of that, and acknowledge that it's very difficult. And that's, I think, also where the peer support comes in, because as our family navigators are also parents of children with special needs, they have been through a lot of that frustrating experiences that our families have experienced. So I think that definitely is a variable that helps a lot in that regard. I would say another component that we have in our program that was added maybe after a year or two of the program existing was we have a part-time clinical social worker who also works with our families, not with every single family, but when we identify certain barriers, such as this one, or they're really struggling with multiple children with disabilities, or they're struggling with their mental health issues, things like that, we are able to connect them with our social worker in our team, who can meet with them for up to 6 sessions for free, is covered under the grant. And with the goal, it's not therapy as you would for anything that you need necessarily. It's very short term, very solution focused, but the idea is to help those families overcome some of the initial barriers they may have in being able to establish that connection. So the goal may be connecting them with a mental health provider in that community who can continue to do the work, for example. So that's definitely another component of our program that it has helped us a lot in terms of overcoming these kinds of barriers.
And I would like to add that the things that we do, our actions, also are part of the process to recover the trust of these families, right? Because if they leave a message, right, and we call the next day or in 2 days, that's one way to show we are listening to you, and we are now reaching out to understand what the situation is. And if we say we will, maybe we don't have some information that the parents are asking for, and we say we will research and be back at you, we will. So we don't offer things that we cannot meet later. So we are consistent in the kind of support that we offer to our families, and many times we do more than we should do to connect these families with the resource needed. If a family needs help to fill up a form because they don't speak the language, we will do it together, right? And it's a matter of being there when they need it. So our actions help to regain the trust. And actually that's a common comment among the other outcomes that we collect at the end of the process. When we close the case, we send to families a survey, so they have the opportunity. It's completely anonymous, so they have the opportunity to provide feedback, and we evaluate 3 areas. One is the performance of the family navigator, the support in terms of the service that we provide, and then at the end is the overall impression about our program. So we receive comments regarding that you did what you offer to do. You were there when I called, you called me back if I couldn't answer the phone, you really connect with the agency that you mentioned, you didn't forget about me. So I think that's part of and it sounds very basic, right? Because every program should be doing that. But yeah, that's part of our success in the connection rate.
That's phenomenal. We've covered a lot of ground in a short period of time, actually. I have a number of questions that were submitted through the online platform, and I'm going to start pivoting soon to some of the questions that have been submitted through the chat here. I do also want to acknowledge that we have a lot of just wonderfully cool people in the room with us, and we're so grateful for you coming into this space. Some of you are doing work that is similar in spirit, and have come to and have seen connection in the content to your own work. So I just want to pause here and give some space if folks in our virtual room would just like to share any reactions or thoughts based on your own work and what we've covered so far. I'm going to hold some space for a few moments here if anyone would like to say hello or share a reaction before I move to our next question.
I think you have 2 people that raise their hands.
Yeah. Beautiful. Thank you so much. Trisha, I'd love to hear your voice. Why don't you come off mute now and make your comment?
Thank you so much. This is just absolutely wonderful information. I can't wait to pass this along to so many people. My question is, and I'm hoping we get to that sustainability question that I put in later, but my question is, how in the world do you serve that many families with only 2 part-time navigators? That seems like a lot of work.
I think that part of it is that, you know, some families need a lot less, other families may need a lot more. So it's not the same for everyone. It's really, we try to meet them where they are in terms of addressing their needs. With some families, it may just take a couple of conversations and that's enough. And so, and then we also have the support of the social worker who's part of the team. We also have Nancy as the director who jumps in and meets with families when needed. And I should add, we have a third family navigator or part-time also who she is of Haitian descent and speaks French Creole. And when we have Creole speaking families, she also helps with that, even though most of her job tends to be more for technical support of our program. She does jump in and see some patients that may need her services. So there's additional supports beyond the 2 people.
That makes sense. Thank you so much.
And I would like to add that also another important factor is that we have a solid structure behind the program. We have a set of policies and procedures, we have a manual, and we have a solid database where Gabby and other former medical students have contributed a lot. So our systems and that our databases help to reduce the time to find some information. So we don't have to find one thing many times, because when we find it, it is in our database. So that's problem solved. Now I just have to go to the database.
Yeah, if I can add to that, from the medical student perspective, we've actually established like a really durable and solid database. So there's a log that the navigators continuously update, and we've really structured it and streamlined it so that way the data can be collected really efficiently and quickly, and that way it's also very readily analyzed, and we're constantly analyzing the data to see where we can improve or what we're good at and how we can get better at things that we're not as proficient in. And I think that's really helped the program really be very efficient.
I don't know if folks saw, there are a couple of reactions that sprinkled across the screen based on the comments about data that may have been exciting for folks. So Debbie, I see you have your hand up. We'd love to hear your question as well.
Hi, Miss Nancy, this is Debbie from Title V in Tallahassee. I have been on meetings with you before. I recognize your face. And I just want to tell you and the other ladies that I really appreciate the job that you're doing to help the families in your area, which in turn will eventually help other families in other areas, because we're all learning from each other. So I'm very grateful for your time that you're putting into this program. I did want to say a little bit about what you were talking about as far as the non-Hispanic white families not really connecting. And I would have absolutely no problem going to you ladies, because I'm married to a Hispanic man, but I feel like maybe because of the area you're in, most of your, or a lot of your information is put out there that targets the Hispanic culture. And maybe you need to step back a little bit and, you know, maybe reevaluate some of the communication that you're putting out there, so that people won't feel like, well, I don't know if I would be comfortable going there, or I may not understand what they're saying, or you know, they have different needs than I do as far as the culture's concerned. Me, I wouldn't have a problem. I love everybody and will go anywhere I need to go for help. But, you know, that is something to think about. And, you know, I'm not saying that that is true, that that's what's happening, but it's just a thought, because your services are so valuable and so needed by people in the community. I just want to be sure everybody gets a chance to utilize your services and benefit from them.
We definitely appreciate your comment very much. That was definitely a finding that we were a little surprised by, and we didn't know what to make of it. But I definitely appreciate your reflection on it, and definitely we want to continue to do better and learn from what we're doing. And so, and that's a big part of why it's so exciting to have the data piece of it, and have the students help us with being able to take a look at the data so that we can continue to make changes and learn from what we're doing. Certainly in an effort to serve, you know, maybe minority groups within our community, we've neglected, you know, other folks, not on purpose, but it could have happened, and we didn't realize it in terms of our promotions or our advertising, or even how we talk about the program. So certainly something that we're going to take a look at so that we can do better.
Yes, ma'am. Well, like I say, I first of all wanted to thank you ladies for the job that you're doing. It's phenomenal and it's greatly appreciated. And I hope that I in no way, you know, offended or put my foot in my mouth by saying, maybe, you know, this is what's happening. It's just an observation from a bystander, you know, and I appreciate you listening to me.
And actually, we are about to close our fiscal year at the end of July, and we are in the process to, we already sent our proposal to our funders to see if they are still interested to invest in this program. And one of the new things that we are proposing is to hire African American family navigator, so we can start building more cultural sensitive strategies to serve this population.
Yes, ma'am. That's wonderful. Thank you, ladies.
And I think this also speaks to the importance of not only having this program, but really analyzing exactly what we're doing in the program, because this was a finding we weren't even thinking of, we weren't expecting to find, but we found it, and now we know we're going to deal with it, which I think also speaks to the strength of our program as a whole. And I think this also is important to note that we are a South Florida program, and this is a very Hispanic population. So I think that also has to do with who we serve and who we hire in addition.
Tremendous. Thank you all. Christy, thank you for your patience. We'd love to hear your voice, and then we'll move back to some of the questions that have been submitted via chat.
Hi, thank you. I think this program is absolutely amazing. I am from South Louisiana. I am a parent. My son, I have 3 sons. My oldest son is 19. He has a dual diagnosis of Down syndrome and autism. And so 19 years ago, when I had him, there was very little compared to what there is available now, as far as services and supports. But I do work for Families Helping Families. We are 10 resource centers throughout the state of Louisiana. So in each region of the state, we have a resource center, and we like to say it's who we are. And what we do, because we are individuals with disabilities and family members. And there's usually the average is about 8 people on staff at each resource center. And we each take a role, and we assist families and individuals in the community to connect them to resources, services, and supports. So a lot like what you guys do. but we are spread throughout the state of Louisiana. So we cover the entire state. I'm the community outreach specialist for my center. And so what I do is I do outreach to doctors' offices, to daycares, child cares, schools, and just different places in the community that our families would frequent. And so I am constantly out there giving them the information about our center, or centers, the different programs that we have, different services available, different events that are happening. So I think this is great. I would suggest doing a wider spread for the state of Florida, that our families really need it, not just in Louisiana, not just in Florida, but all over. So I think it's great.
Yeah, we would love to do that. Of course, it always comes back to funding, right? We are fortunate. I think that was one of the questions I saw in the chat was about funding, and the way we're funded is through a private foundation, the TAF Foundation, and they've been supporting our program for the last couple of years. I mean, the last 6 years, I should say. But yeah, it's limited in terms of what we can do and how far we can go. And that's actually how the idea of training community partners came to be. I think that's another question too in the chat, which is that we started maybe 4 years ago or so with Nancy developing a curriculum and partnering with community agencies that were already providing case management or care coordination, but may not have had the expertise on working with individuals with disabilities. And so we began by having her offer this training to those employees in those agencies. It's in an effort to build capacity in our community. That evolved into developing training modules online, which we realized that, Nancy is only one person and we're limited in terms of how much she can actually do. And so by creating these modules, and our funder loved the idea and supported us in these efforts. And so we were able to create the modules. And the way we're doing that now is it's a combination of, we partner with an organization, again, that is already providing case management of some sort. We offer them to participate in the training by first, they do the modules on their own, and we give them a timeline to do that. And then there's 3 follow-up meetings with Nancy, where it's more of a coaching meeting where she can provide more information, she can answer their questions, they can talk about specific cases, things like that. We also give them access to the data system that Gabby and Nancy were referring to earlier, where we have all the different resources in there as far as what's available in the community for different populations. So we make that available to our partners as well. And that's how we are attempting to kind of build capacity.
So I would suggest maybe getting with the Developmental Disability Council. The Louisiana Developmental Disability Council is where the funding for our Help and Families Resource Centers comes from. But also keep in mind that a lot of the support that these families need, and myself included, I was a single mom at a very young age, 19 years ago. And so that peer-to-peer support, talking to another person who has been through it and navigated these different resources and services and everything, is extremely important. And I say we because for a long time I was unable to work because I couldn't find an employer who would be willing to hire me because my son had special needs and special healthcare needs and needed to see this doctor or this specialist. So keep in mind that those family members and those individuals with disabilities can take on that role as a family navigator.
Yeah, that's definitely part of our program, where we have that our family navigators are parents of children with disabilities or special needs as well. So that peer component is definitely something that was identified early on as a very important piece of the services that we provide.
Dr. Schenker, because you mentioned this question, it was submitted by Tricia earlier in our Q&A. You had mentioned about how the project was funded, but she asked a second part of her question, how you plan to sustain it. Do you mind leaning into that second part of the question a little bit?
I think that, well, part of the sustainability piece is that the trainings that we're doing with our community partners. So I think that's how we hope to be able to continue to sustain the efforts that we're making. As far as us being able to continue to provide direct services, one of our faculty in our team, Dr. Brosco, who actually was the person who originally created this program, he's very involved as far as advocacy and politics and that sort of thing. And so we've had many conversations about, would we be able to bill services? Will we be able to bill insurance companies and things like that for the work that we do? And that I know is something that he always keeps an eye on, and is hopeful that in the not so distant future, this will be a kind of service that we will be able to bill for.
I see a couple hands up. I want to just cover this one other question in the chat real fast, and then I'd love to hear these final voices as we have 5 minutes left together. A couple participants expressed interest in learning more about your network of like-minded programs. How can folks get connected and sharing about that? What are your thoughts on that, team?
Nancy, I can say something really quickly, but this is actually a really exciting new project that we are taking on. Like Nancy mentioned, there was a medical student who just graduated on the team, but we now have a new first-year medical student on the team. And she's kind of taken this on as her research project, where we're actively now trying to put together a network of nationwide like-minded programs. So this is still very much underway, but we are trying to actively collect data on different programs that are just similar to ours or offer similar services. So I think by building the network is one way you can get involved in letting us know you're out there, whether we connect to you or you connect to us if you hear about us like at conferences like these or any other way. And then hopefully we can build a very robust network.
Maybe we can share, maybe Nancy, you can share your email information. Okay, great.
Yeah.
All right, so we have 4 minutes left, but Jen, we'd love to hear your voice in our closing moments.
And maybe this isn't a good closing question, but I've heard you guys mentioning your database and your resources, and I'm wondering, how is that set up? I think that's a huge mystery for family centers who are trying to get resources to families. It's hard to keep it up to date. It's hard to organize it so everyone can see it. So I'd like to hear a little bit more about that.
It is a huge task, definitely. So as we have mentioned before, we have been very lucky to count with the help of medical students. The first one, Allison, Gabby, and now Destiny, and they were the ones who helped us to build the databases that we have. But what many people imagine something really fancy, but it's not. It's an Excel. They are Excel databases where we keep the information organized and where all family navigators have access to. So every time that we need to enter any change, any edit, we will do it, and everybody is looking at this information at the same time. And other things that we did was, in the training for community agencies, we are providing them the access to these databases. So now it's not only the family navigators that are working on the database, but also the community agencies representative that can add their own information at the same time. So that's one of the ways that we keep this information up to date, but definitely is a task. Sometimes it's a headache because many programs open, close. From time to time, we can say, oh, we have this information and now this organization is not working anymore. So once again, it's a constant process.
And I would say though that Nancy's role is a really important role in terms of a lot of what she does and has done is maintaining those relationships, is going to all those meetings, it's constantly being aware of what's available in that community and updating that. And you know, if she was seeing patients full time, she wouldn't have the time to be able to do that. And so a big part of her time is spent doing that networking, that just updating and recognizing what's available.
Yeah, being an active part of what is happening in the community is key. Just like last night, we were participating in a private school resource fair, and we met so many people that are having their own non-profit organizations. Specifically, yesterday was about Down syndrome. So we came out with 3 new potential community partners, but you don't know about them unless you are actively participating in these kind of events.
And I think one more comment that I can say as well from the data perspective is, if you aren't already, I think it would be a good opportunity to find a local institution, whether it's an undergraduate university or medical school, where you can find students like me who are willing and are knowledgeable in the research realm to either help with the data processing, the data analysis, and we do it for free, because we are also looking to get publications, or we have the background in training, like we have a master's in public health. So I think that's something, if organizations that are like us haven't had the opportunity to look into, I think it would be good to partner with any local institutions that are in your area.
Wonderful. Thank you so much to our tremendous speakers and participants in this session. I know I started today a little heavy, and being in this space of love and generosity and sharing and just tremendous good work has lifted my spirits. So I'm grateful to be with you all, and really looking forward to seeing everyone later in the day for workshops and our plenary sessions and networking sessions. So thank you to our speakers as we conclude this time together, and looking forward to seeing you all online very shortly.
Thank you, everyone.
Thank you, everybody.
Bye.
Good afternoon.
Have a good day.